Everybody.
So good evening, everyone, and good afternoon for some of you are in California. It was so nice to meet all of you. And thinking about what pandemic taught us, basically today is the benefits what pandemic taught us. Looking at the geographic diversities today, I'm so impressed with you all are here to be able to be all on the screen here. So my name is Mei R. I'm a nurse scientist, and I have studied lymphedema for 20 years. My first study was my dissertation for my PhD doctoral degree when I was a nurse, clinical nurse specialist at cancer center, and working at cancer center, see patient came and with lymphedema, and they will say, when the doctor came, say, how are you doing? And they will say, I'm doing well. However, my arms are hurting and the swelling cannot be getting off, And the physician I worked with is very nice gentleman. He always say, honey, remember, you survived. And then when the oncologist went back then, and then my patient would say, May, I don't want sympathy. I want to know where I can find a treatment. Think about 20 years ago, there's very much limited treatment. And so I try to understand what is people who with lymphedema living in their daily life. And that was my first study, was a dissertation study. After that, I basically did 30 or 40 studies and published over 200 research articles, and also book chapters, a total like 300 publications and more than 300 presentations. I'm specifically interested in lymphedema symptoms. It's not per se how big your arms are, really like what you come through. So with that, I'm going to share my screen and then to share my knowledge with all of you. Give me a second, my screen's black at this moment, so. Do you see my screen like a big screen with, yeah, great.
Yes.
Yes.
Yeah, so today, and I'm going to share with you my knowledge through all my research and how to manage in the course and effects of lymphedema. So I worked at New York University and New York University Cancer Center for 16 years before I moved to other schools. So currently I'm a professor of nursing at George Washington University. And before that, I was a senior associate dean for research at Rutgers, and also endowed chair at Boston College. Before 2019, I worked since from 2003 to 2019 at NYU, New York University. That is also the reason I have served as a speaker and helping with patients in the New York area for more than 16 years while I was a professor at NYU. So when you're thinking about lymphedema and the definitions of a lymphedema, actually, like one of my patients said, it's not just the big arm. It's basically is a syndrome. It's a combination of symptoms and signs of accumulated fluid in the what we called interstitial space, which is between your cells, in the third space, in the arms or in the upper body. Like one of my patients said, if you have a breast cancer, you treat it. If you do not, you're in remission, you always forget about your cancer experience. However, with lymphedema, it's almost like a daily reminders you have that problem. And also what happened with lymphedema is another chronic illness. Basically, there's really no cure, no pharmacological treatment for lymphedema. If you're thinking about from the surgical point of view, what are the causes of the risk for lymphedema is basically it's removal of the tumor, because our lymphatic systems is along all our body. Anytime you have a trauma, anytime you have incisions, and you will interrupt with the superficial lymphatic systems. And we all understand lymph nodes is the important part of lymphatic system, which will filter viruses, bacteria, cancers, and also direct the lymph flow. So when we have incisions in our body, and when we have a lymph nodes removed, and actually we interrupt our body's lymphatic system to help the lymph fluid flow. And in that, so at the very beginning, you will find out there's accumulations of swellings in the area, or some of the patients, because their body can compensate with the compromised lymphatic system, it's always by the 10th year and 20th year. When my patient was 86, it was after 50 years of the surgery, she had a lymphedema. She said, I almost forget about it until I got a lymphedema. And the radiation is another cause for lymphedema. Basically, radiation will make fibrosis and injuries in the lymphatic system, fibrosis for the lymph nodes, and also your lymphatic vessels, you know, and also depends on where the radiations, if it's on the left side, which is the biggest duct in your chest, and also right side, and which will drain your upper right and head, and the left side will drain all the fluid from your whole body. And it depends on which side of your radiation, how many doses, and your risk to get lymphedema will be varied. However, all of those surgical treatment is still the optimal treatment for cancer. So it's very hard for us to modify. I think doctors, researchers try very hard to bypass the lymph nodes, bypass lymphatic vessels recently, but still need a lot to do. And then when I first studied lymphedema and really tried to understand what are the risks, you know, when you're thinking about other risk, what we call the personal risk, is those are the factors that will increase a person's susceptibilities to lymphedema. But remember, all of this doesn't mean you will have the lymphedema. Even if you have all the risk factors, you will not have a lymphedema. It's just a risk factor. So in 2009, I finished one of the study. And in that study, actually, I found after a year, surgery, chemo, and radiation does not have any direct relationships with lymphedema occurrence and how severe lymphedema will be. Actually, I started to think about maybe there's genetic associations. So I basically applied a grant. I got a grant from NIH to study what are the genetic predispositions for lymphedema. And we also understand just being Black or African American or Hispanic Latina, and will increase the 3 times of the risk to have a lymphedema. And recently in 2000, I finished another study with 600 people. We also find having a financial hardship, we defined as cannot make the ends meet. Those patients actually had almost 5 times a risk to get lymphedema. And this is the first time we find out the socioeconomic factors will have a big impact on lymphedema occurrence and severity. although those are like a difficult, not difficult to, difficult to modify. So for example, if we have a genetic predisposition, if I'm Black, if I have a difficulty in finance, it's still very hard to modify, very hard to modify it. But doesn't mean if we have all those difficult to modify causes or risks, we will have an lymphedema. So I want to share with you, in my study, early on in my study, it was amazed to me, and I will have a patient came, only have one lymph nodes removed, and who will have a lymphedema right away, and who will come to me say, I'm so painful, look at my swelling. So in this study, I really try to understand whether the swelling and also what I call lymphatic pain will have a, lymphatic pain is a pain with a swelling, whether all of this will have a genetic predisposition. To my surprise and to the research surprise, actually, for the lymphedema fluid accumulation symptoms, actually interleukin 6, interleukin 4, which are all we call inflammatory genes. So if a patient have a one gene affected, this patient will have a more than 2.38 risk of an lymphedema. But if a patient have two genes affected, actually the patient will have almost 5.29 times of risk to have a lymphedema. And when we're thinking about pain, remember, like some of you feel like I don't have a pain. 50% of the breast cancer patients after treatment will not have a pain, but 50% of the patients will have a pain. About 44% of the patients not only will have a pain, but also will have a swelling plus pain, which we call lymphatic pain. And we found there's two genes. One is called, we call VEGF, which is a lymphatic system gene. Another is a interleukin 13, which is another inflammatory gene. So what we found, if a patient have a gene affected, one gene affected, the patient will have a two times of risk to have a lymphatic pain. But if the patient have a two gene affected, their pain will have a more than 86 increase of the pain. This also explains to us why some of the patients after the surgery will have no pain, minimum pain, but some of patients have the pain really severe. But some of the causes or risk factors for lymphedema, or what I called, you might not have a big arms, but you will have a lymphatic pain, like you have a pain and just you feel swelling. And some of those causes and the risks, such as immobility, just sitting, sedentary lifestyle, or high body mass index, high BMI, or just inflammation for your body, have a chronic illness, have a chronic fluid accumulations, and will increase your inflammations, which I will talk about strategies for each of those causes and risk. And then we also have some what we call the triggering factors. Triggering factors is not the cause, but will trigger the formations of a lymphedema, will also trigger the lymphatic pain. For example, even healthy people like me, when we walk outside, when it's 100 degrees, what will happen on your hands? You have swelling fingers, right? And your whole body is swelled. So basically extreme weathers, either extremely cold or extremely hot, will trigger lymphedema for either a patient, a breast cancer patient or other cancer patient, or sometimes even for healthy people. And if we have a very constructed clothes on our body, when we cannot breathe well, when our breathing is kind of constricted, actually that limited our fluid flow in our body, and that might also trigger the lymphedema. And any injury, many of the patients who have lymphedema has no cancer treatment. They just have their ankles sprained, they have your arms scarred, they have your fingers scarred. All those injuries might be interfere with your lymphatic system. If you have a genetic predispositions, and might trigger your lymphedema. Finally, like a skin infections, inflammations, and basically will trigger the lymphedema. But all those triggering factors will be able to modify it, and which I will talk later on, how we can take strategy to modify those factors. You know, having lymphedema, and even just, you don't have an lymphedema, you just feel you have a swelling, you just feel you have a pain. It's really create a lot of negative effects in our body. First of all, you know, you probably do not feel very comfortable. You will have a lot of symptoms. You will have a lot of physical discomfort. Sometimes many of my patients say, I cannot stir my foot that much. I cannot lift heavy things. I cannot really use my hands very well. Some of the patients who have to type every day, and actually they cannot do that all the time. And so for many of the patients, self-esteem, interrupted interpersonal relationship, but most importantly, you know, if we already have a financial hardship and having an lymphedema makes you need to put money for special moisturizer, compression, and maybe you need to ask people to help to do some houseworks, create a lot of financial burdens to us, and also require us to have some lifestyle changes. But most importantly, in the 13 activity of daily living for the woman, like a cooking, using a knife, writing or typing, cleaning, vacuuming, doing laundry, carrying objects, yard work, dressing ourselves, bathing ourselves, driving, making bed, taking care of the children. All of this for people who have a lymphedema or just have a pain and lymphatic pain, actually all of this impact the daily activities. For me, I think that's the biggest impact in our daily life. So I'm given this link, which will tell you about what lymphatic systems is. First of all, in order for us to manage the cause and manage the effects of a lymphedema, we need to know our body. So the lymphatic system, actually, it's a very important system in our body. Is a system which help us to strengthen our immune system. That means to say any bacteria, viruses, and also any of the toxins come to our body. The first, the goal is go to the lymphatic system. And through the lymphatic system, which is our immune system, to kill the bacteria and or viruses, or to get rid of the toxins. So our lymphatic system is our immune system. Second, lymphatic system is an important system to regulate our body fluid and is hand in hand with our cardiovascular system. So for example, for heart failure patients, for fluid overload hypertension, and actually if we're touching on fluid overload, try to get rid of extra fluid in our bodies, and actually that's the ones help us to not only decrease our fluid on our arms for breast cancer patients or our trunk. However, even for high blood pressure, heart failure patients, will help them to manage their fluid overload symptom. Third, lymphatic system is our, we talk about immune fluid, but also it's a system help us to decrease inflammation. Lymphatic system to help us to decrease our internal inflammation by really regulate our fluid in our body, but also help us effectively decrease toxins in our body and decrease the viruses and bacteria in our body. I will strongly encourage you to go to this website and just take a look of the video about lymphatic system. It only takes 5 minutes. Another important things about lymphatic systems is the lymphatic systems cannot be enhanced by any medications. So for example, if you have a high blood pressure, say, okay, take this medication. If you have a heart failure, take that. But if what will help with lymphatic systems is not about medication. It's basically about the muscle pumps and the breathings, which will stimulate the two big lymphatic ducts on our chest to help us. That is also why when we say exercise is good, because exercise help you to create muscle pumps, which will help your fluid goes very effectively. And when you have a deep breathing and actually help you to stimulate, activate your lymphatic system. And we also need to know our body. You know, I always tell our patients, I said, nobody knows knows better than your body. Let's just know our body as something can teach us what's going on in our body. For breast cancer patients, actually, there's 24 symptoms actually you need to monitor. So like every time when you wake up, you need to think about, do I have a limited movement of my shoulders? Can I move my shoulders? Can I move my elbows? Can I move my wrist? Can I move my fingers, right? Anytime if you feel there's something there, and you need to think about whether you need to do some exercises to help yourself. And do you feel swelling? Do you find your breast swelling? Do you find your chest wall is swelling? Do you feel like your whole body kind of firm, tight, heavy? Or do you feel like your skins become tougher and stiffer? You know, do you feel your tenderness in your arms and in your bodies? And do you feel like your skins are hot or have a redness, have a blisters? Do you feel pain? Do you feel aching? Do you feel tenderness? Do you feel burning, stabbing, tingling? Do you feel arm cannot doing anything? If you, every day, if you have all these 24 symptoms in your mind, and when you wake up thinking about, oh, I feel good, I don't have, but if some of the symptoms occurs, you need to think about, okay, if I do a lot of breathing, if I do a lot of some of the lymphatic exercises, can all the symptoms tomorrow get disappear? If not, in 1 week, you should call the doctor to really check out whether it's a cancer recurrence or whether it's just a fluid accumulation for it. So know our body and know the symptoms is important. This is also, I want to share with you, all those symptoms I listed here are the significant predictors. Like we said, after several studies, we found out those are the significant predictors of an lymphedema. For example, if you feel your arm are swelling, that means to say 100% times you will have an lymphedema. If you feel your arm are heavy, 17 times you will have an lymphedema. And even if you feel like your arm, your upper body are stiff, you have 3 times of risk to have an lymphedema. So this is also why we need to know the symptoms. We also need to know our body, because all of them are the significant predictors of an lymphedema. And also, all those symptoms are all closely correlated for what we called lymph volumes. Lymph volumes is like how many of you go to the therapist that measure you, right? So I studied all the symptoms, used the sequential circumference lymph measure. They all closely correlated. I also did a study looking at bioimpedance measures of body fluid. This is the most accurate measures for the fluid in your body, and I studied how the symptoms correlated or associated with bioimpedance. They are very much correlated and associated with lymphedema symptoms. I also used infrared Perometer measurements, which you just move it's an infrared, you just put your arms in within 2 seconds, and it will tell you how much for each arm your lymph volumes are. And then all those symptoms are also significantly, strongly correlated with infrared Perometer. So the reason I'm showing you the objective measures of the fluid with the symptoms is because I'm glad, like Megan said, by the end, the doctors and healthcare providers understand patients are the most important collaborators in healthcare and in research. Because early on, when you go to a doctor, you say, I think my arms are swelling. Your doctor will take a look. I don't think so, and just dismissed, right? That is the reason I started say, hey, even if our patient report arm swelling, basically it's a 500 times probability this patient will have an lymphedema, basically. And then if you understand the pathophysiology of the lymphatic systems and how the causes of the lymphedema and the lymphedema symptoms, even if you are not diagnosed with lymphedema, if you have a lymphedema symptoms, you probably have an early stage lymphedema, which cannot be measured by tapes, by bioimpedance, and by infrared. But you have an early stage of lymphedema, which cannot be measured. But if you understand all of this is because of accumulations of lymph fluid in the third, like interstitial space between the cells, and you probably thinking about maybe the strategy to promote lymph flow is the best. So with my research, and actually I interviewed 120 patients, and I studied with all those technologies, and based on all my research, and we developed what we called the Optima Lymph Flow Program, which is a nurse-led and focus on pathophysiology of lymph fluid accumulation to help the patients to promote lymph flow. Many of, some of the patients in New York, probably I have 5,000 patients in 16 years in New York area participating in my study. Many of them have done a lot of research with me. So I'm going to go through with all the clinical trials we have done with this program. So the first studies we did is basically we try to say if we can measure the patient before the surgery and follow them for 12 months, and also teach them the optimal lymph flow programs to promote lymph flow, and whether it will help them to maintain their post-surgery lymph volumes, and also will help them to decrease the risk of lymphedema. And this first study produce a positive results, and we have a 97% patients maintained their pre-surgery lymph volumes. We only have a 6% of patients had a lymphedema. And then Because in my study, I also figure out lymphatic pain, a lot of patients suffered most when they have a pain and a swelling combined together. They have so many pain, which impact their life greatly. And I basically conducted a randomized clinical trial to looking at whether we can manage lymphatic pain and lymphedema symptoms. And so using the optimal lymph flow and the shoulder mobility exercise. And in this study, we found out the TOLF, the optimal lymph flow program, actually decreased 13% of the medication taking, also decreased 40% of the lymph volume, but also 50% of patients decreased pain and swelling. And then we also did another study to looking at patients who after the surgery have a higher risk. We defined, that's the third study, we defined higher risk as people after the 3 months after the surgery, they have 5 symptoms out of the 24 symptoms. We classified them as a high-risk patients. And we also randomized them into optimal lymph flow and shoulder exercises. In this study, we also found more than 30% of the patient reversed lymphedema and symptom-free compared to the shoulder mobility exercise. And then in the 4th clinical trial, we're also looking at patients who had a lymphedema, mild lymphedema, and severe lymphedema. We want to see if we give them the optimal lymph flow programs, can we reverse mild lymphedema, also improve the severe lymphedema in this study? And we showed if the patients only have 1 centimeter differences between their each arms, and the TOLF programs actually can help them to reverse their lymphedema. For patients who had a severe lymphedema, actually was able to really decrease a lot of lymph volumes and symptom burdens for the people who have a severe lymphedema. And then we use the AI, artificial intelligence, to teach our patients how to do the lymphatic exercise accurately. And in this study, and we found out only 1 dose of lymphatic exercises actually decreases pain and also lymph fluid level measured by BIOIMPEDANCE, which was accurate measures. And actually, we have a patient who had 300 lymphedema index, and after 1 dose, and she decreased 50 lymphedema index with that. And finally, we also did a study using the same program for the heart failure patients. We found out we were able to help the heart failure patients to really maintain their fluid and also decrease their fluid overload symptoms such as swelling, pain, and shortness of breath with that. So today I want to share with you all the strategies we used in the optimal lymph flow strategies, which targeting on immobility, high body mass index, and inflammation. The first one is very simple, is what we called muscle tightening debriefing. The reason muscle tightening debriefing is because the whole body, the lymphatic systems can only activated by debriefing. That's why if you can get yourself every day, just schedule yourself 3 times a day, each day you do a very good night debriefing, and it will help you a lot. And some patients who had a severe lymphedema, I basically tell my patients what you do whenever you get up, just have a few debriefing. But this debriefing is different from what we learned from like abdominal debriefing, right? Abdominal debriefing is basically you want to enlarge your lung capacity, but this is not. This is the opposite. This is when you breathe in, you tighten your whole body muscle. When you breathe out, you let your body relax. So in that way, you kind of create a vacuum and the muscle pumping for your whole body. So I would encourage all of you to try 20 or 10 breaths in the morning, during the noon, or before you go to sleep. And because that will really help you to activate your lymphatic system to move the fluid more effectively. Even if you do not have an lymphedema right now, I would encourage you to do that because that will strengthen your immune system, help you to really to be cancer-free for the rest of your life. Second is, remember we said the most important for lymphatic system is muscle pumping, right? Only when you have a muscle pumps and your lymphatic systems will work. That's also why if you're looking at all the chronic illness, all the cancer survival programs, you like do a 30 minutes of walking, running, swimming, yoga, it's because when you move your body, when you exercise, and actually you are creating a muscle pump for yourself, So even if you do not have a time to walk like 30 minutes 3 times a week, I would encourage you just like walking your hallway or walking in your bedroom, stand up, move up, do a little bit dance and just move your arm a little bit, and that will help you with your muscle pumping. And then a lot of patients will say, as a breast cancer patient, we're all told we have to be careful with our exercises. And some of the patients will say, I'm older, I haven't been get exercises after surgery, I haven't started exercise. So I would love to give you some of the guidelines for safe exercise guidelines. So basically, you always start low. So for example, if you want to do a weightlifting, you start with 1 pound. And you start with 1 repeat or 2 the first day, and then you gradually build it up, okay? So you don't want to walk. If you never walk for 30 minutes, you don't want to walk the first time for 30 minutes. Maybe the first time you walk for 5 minutes. And you can also do walking, swimming, or sometimes cycling those, if you feel like swimming is a little bit tougher, and walking is always a good way to choose aerobic exercises to help you. For all the breast cancer patients, I always want you to do a lot of flexibility, stretching, breathing, even like a little end of like a naked arm exercises, and to maintain your range of motions is important, But most importantly, I would encourage you when we say warming and cooling, really do your deep breathings before you start your exercises, and end your deep breathings with your exercises. For patients, there's who wear the compression garment all the time, and actually, the research still inconclusive whether we should wear our compression garments or not. But I think use your common sense. When you do the exercises, when you feel like if you wear your compression garments is better, wear it. But if you feel like when you do your exercises, your muscle cannot expand, cannot be really doing that much, and maybe it's better to not use the compression garments when you do the exercises, but use your own common sense. If you wear your compression garments, exercises cause you pain, you need to take it off, because that means to say it's restricting you. You cannot really help the muscle pumping that well. And also, when we're thinking about nutrition, it's always the best things for our life. I also understand how tough when we try to eat a nutrition balanced diet, but I think you don't need to have a very detailed and also very costly diet. You know, all we can do is just eat more vegetables and fluids, but what we call the quality proteins. You know, I usually tell my patients, you know, fluid, vegetables, chicken is the best protein, eggs are best protein, and fish, but not eat the farmed fish. Always eat the wild caught fish, because farmed fish sometimes have some toxins which may bring more toxins on yourself, you know. But organic chicken, you know, it's very good, and eggs are very good. Beans, you know, are very good. Nuts are very good proteins, you know. And also, if you feel like your BMI is around 30, or your BMI is over 30, the best thing to do is always don't eat 110% full. Maybe gradually, like today, I'm going to just eat 105 full. Tomorrow, 100% full. Next week, I eat 90% full. Maybe next month, I eat 80% full. Next month, I just eat 70% full. So if you have a habit to keep yourself 75% full, and then you will not be able to overeat. But this will be okay if you go to vacation, right? If you have friends at home, it's fine. Occasionally eat a little bit more, you know. And the reason for that is because extra pound of the body fluid, and especially if the extra pound is all fat, are not muscles, and actually will cause your lymphatic system working hard, because you have a less muscle to pump to help your thing. And then also always remember, you know, there's so many programs for weight loss, but majority of them, if you have to, like, if the programs always have a rebounds, and think 3 times, maybe it's better just eat healthy, keep yourself 75% full. Maybe that will help you better than go to extreme diet and extreme fasting. And because the rebounds will put a lot of heavy burdens on your body for it. And believe or not, many times it's because we're thirsty, and then we thought we are hungry. So always drink 6 to 8 glasses of water, you know, because drinking water, you know, sometimes you feel like you are drinking water, you feel like it's not good. So, but a lot of times if you just schedule yourself, say, okay, in the morning, I drink 4 glasses of water. In the afternoon, I drink 3, but maybe after I eat, I just drink 1. But I also encourage you not drink any juice, because the sugar there will be really create a lot of problems for our body. Green tea is a wonderful thing, you know, which will boost your metabolism, and green tea will also help you to detoxin, you know, any tea, even black tea, because some people feel like a green teas also will upset their stomach, but even a black tea, brown tea, herbal tea will help you a lot. Believe or not, a lot of times sleep is the only thing can help us to get better, to decrease our inflammation, to help us to have a rest, and also decrease our stress cortisol. And because when we are stressed, we have a high cortisol in our body, and our inflamed, and we have a more water retention, you know. And also remember, when you sleep 1 hour more better, and you will have a significant reduce of the belly fat accumulations. And then for the triggering factors, infections, injuries, restrictions, extreme temperatures, skincare for all of us are important, low pH and water-based moisturizers. The best ones is Cetaphil, which is very cheap, but these are the best moisturizers you can use, CETAPHIA, Cetaphil, and I'm not allowed to write the brand, but that's the best low pH and water-based moisturizers for all our patients. And always wear gloves, even if you're washing your dishes, cutting your vegetables, especially when you go to do your gardenings, when you go to do your yard works, basically always wear protective gloves, because once you cut, even if you cut your fingers, you don't feel it, but if you don't wear gloves, the bacteria will go in and that will trigger lymphedema. How many of you, because of little cut and little snap on your fingers, and actually got lymphedema, right? Because that's because of the bacteria. And always, whatever you do, going travel, doing your exercises, having a fun, always thinking about, do I wear a safe shoes for myself? Because many of my patients get lymphedema is because they fell on the ground and then they sprain their elbows, their waist, or even their ankles, and then trigger the lymphedema. So always thinking about when you go out, what is the safety things? Walking shoes? Did I have a sunscreen on? Did I have enough water with me? Do I have a hat with me, right? And like what I said, especially in the summer, don't wear so constricted clothes. Wear clothes which allow you can breathe, allow your arms can move, allow your legs can move. Wear comfortable, not tight clothes is very important. And most importantly, if it's too cold and too hot, if you can avoid just doing your exercises in the gym, or don't even go out. And those are the ones like common sense. However, sometimes we all forget about those common sense actually will help us to decrease our infection, injury, and the restriction of the clothes, and help us to really prevent the triggers of a lymphedema. And remember, whether you already have a lymphedema, whether you do not have a lymphedema, you just have several of the symptoms, the best management is to promote lymph flow, because when you promote lymph flow, to do breathing exercises, drink water, sleep well, and it will help you to prevent, reverse, or better manage lymphedema. And even if the surgery usually is a great way to have what we called first significant reduction of the fluid volume. After that, you still need to do a lot of lymphatic exercises to activate your lymphatic system to help you to generate a lot of lymphatic vessels to help you to compensate your lymphatic system to help you. And I also want to have a little words about a compression garments. This is what we usually see for the night garments people wear during the night. And those are the garments you usually wear during the day, right? Those are the garments which help you to put those garments in during the day. Those are light garments. Those are the chest compression vests you can do, and those are the pumps you can do. Even if you use all those compression and pumping devices, I would still encourage you to do a lot of exercises, strategy to promote your lymph flow. Because once you do it, you will, after 3 months, you will find the differences. My patients in all my clinical trials still email me. One of my patients said, Dr. Fu, I finally figured out how many times I need to do my lymphatic exercises. It's 6 times a day. And now I'm 7 years after participating in your study, I'm doing very well, you know, after initial lymphedema. So, and also remember, some of the patients will not be able to wear compression garments because it will create more trouble to them. So it's important for you, for us to assess, when I wear the compression garments, did I feel more pain? Did I have more symptoms? Did my swelling get worse? If so, really keep a record on it, go to talk to your therapist. And if the case, you cannot wear any compression garments, and then your job to do a lot of deep breathing exercises, it's a mandate. It's like you have to do it in order to help yourself. And if you see this little frog, this is one of my patients who, when I did my studies, and she handmade for me. And if you're looking at this frog, it's with a butterfly with the blue, which is symbol for the lymphedema. And when she finished the study, she came to the NYU Cancer Center. She basically gave me this frog. She said, Dr. Fu, I want to give you this frog. I want you to remember what you have been doing is important. And I also want you to continue your research so that we will find a cure for lymphedema. Yeah. Although after 20 years of the study, I still haven't found a cure for lymphedema, but I'm still continue doing all the research. Hopefully, compared to 20 years ago, now more and more researchers, physicians, nurses, and physical therapists are conducting research on lymphedema. So basically, I hope me will be the pioneer to push forward the research, and you as a patients are collaborators of the healthcare providers like us, researchers, will push forward. Someday I will be able to tell my patients, say, hey, the frog you gave to me is alive right now because we found a cure for lymphedema. Thank you. I'm going to stop sharing my screen, and then I will answer your questions. Thank you very much.